My name is Cady Williams. I'm a general pediatrician. I work at the Ferlauto Center for Complex Pediatric Care, part of Prisma Health's Children's Hospital. If you're a parent, consider the last time you went to a doctor's appointment. Now consider that you're taking your child to a doctor's appointment, and they also have with them a wheelchair and an oxygen tank and a suction machine and a feeding pump. This is the reality for a parent or caregiver of a child with medical complexity.
My name is Beckett Roper. I delivered quadruplets at 27 weeks. Beckett is one of the four. He was born with 3 rare chromosome disorders, in addition to being born 3 months early. So he had several medical problems in the beginning. He was in the NICU for 209 days when he came home with a trach and a vent, and has been in and out of the hospital his entire 5 years of life.
Bringing a child with that fragility into a medical office setting is sometimes very difficult. It can present lots of challenges. And so telemedicine can be an invaluable service for families and patients who need better access to care, easier access to care, and faster access to care. All right, are y'all all set?
We are all set.
Okay, great.
You can kind of see.
Hey, it's good to see y'all. Hey, Brittany. Hey, Beckett.
Before COVID, cold and flu season, we stayed, to ourselves pretty much, and then it was difficult to get him the care that he needed, while also trying to maintain his safety. My father contracted COVID in December of this past year, and he spent 30 days in the hospital, in which he almost lost his life. He came home on oxygen and has been struggling to get back on his feet. The Tato Care has basically provided us an opportunity for us to get medical help for Beckett, while also protecting our home from any outside germs, not only for Beckett's health, but also for my father's health, as we are trying to basically keep him germ-free while he is recovering.
We have been able to do several really successful sick visits with Beckett over the video visit that gave us great quality and saved an office visit for that family and probably an emergency room visit as well. We've been able to make changes in his medications when he's sick with respiratory illnesses and monitor things closely through the combination of telemedicine and the reports that family and his private duty nurses are able to give us. Our most fragile patients have in their home a special kit that actually allows us to examine them through telemedicine.
And it has a video that allows the doctor to physically see Beckett. It also has individual attachments that allow for a stethoscope, for them to be able to check his ears, and also like a tongue depressor for them to look at the back of his throat. The camera also allows for skin evaluations, and so it basically allows the physician to see Beckett virtually and hear him on the machine, and it basically just instructs me on where to put the machine, and they can hear it through their computer.
With this examination equipment and our familiarity with the patient, I feel we've really been able to do a great service to our patients. I've been very pleased with the quality of the visit. And at some point during the visit, my patients have access to their important support services as well. Our case manager will come in and address case management needs. Our dietitian comes in and addresses nutritional needs. And then we generally wrap up the visit and a summary is sent. Beckett has continued to make huge progress. He had his tracheostomy tube taken out several months ago by the pediatric ENT team. He is working on feeding skills, and he's getting ready to start kindergarten. There are many things during the last year and a half of this pandemic that were good despite the pandemic. We've seen these with our families. People still have babies. People still get married. They still fall in love. There's very few things that were good because of the pandemic. And telemedicine is one of those things. It sent it into overdrive. We are using technology now that we were not using before the pandemic. And we figured out pretty quickly how to use it in a good way, in an effective way. I think that telemedicine won't replace face-to-face visits, and I'm very grateful for that because I love seeing my patients. But it has a very important place to augment the care that we do in the office. Not only is it convenient, I think we've really shown that it provides quality care in a very necessary way.